Hi everyone, it's Dr. Cred, and today I have a unique story for you. This patient here, a patient of mine, had a history of retinal detachment in both eyes. The right eye and the left eye had retinal detachment. Now, he came to see me because he had cataracts that needed removal. And today we're going to compare the vision between the two eyes. Now, the right eye, when it had the retinal detachment, the macula, the fovea, which is the center of the macula, had detached. However, in the left eye, the fovea, the center of the macula, did not detach. And so I want to have him compare his vision between the two eyes. So what's the vision like if the retina detached, right eye macula off, left eye macula stayed on? Before he shares how he is seeing with both of his eyes, I'm going to show you his cataract of the left eye before surgery. This is during the preoperative visit. And then I'm going to show you the surgical video of us removing this cataract. This is in the left eye with the macula on. His right eye, the one that had a Mac-Off Retinal Detachment, I did a few years ago, and so I don't have the video for that one. So your lens implant looks nice and clear on this right eye. Let's go to the left. And it looks beautiful, nice and clear on this side as well. And he has basic lens implants that do not reduce astigmatism. So I'm gonna place the refraction in front of his eyes, and he's gonna compare the two eyes, compare how he sees. First, we'll do subjectively. Can you describe to us, to patients, how you see with each eye? What's the difference between your two eyes?
With my right eye, when I look at the edge of the screen, I can see a little bump right in the center of the screen, about, I would say, 1/3 of that edge. Okay. With the right eye, it's pretty straight.
Or with the left eye?
Sorry, with this eye, the vision, the line is still straight.
Okay.
This one had the retina detachment, had the fovea detached, so I can see a little bump, wiggle in the line, vertical line on the screen.
So this is something that patients with history of retinal detachment need to know. If your macula was detached, if the center of the retina was off, we expect to see some distortion in vision. Even when the eye is wearing a prescription, we expect to see some distortion. However, if the macula did not come off, then we expect no or less distortion. So he's seeing distortion in the right eye, but not the left. And so if you can take off your glasses, this is your most up-to-date prescription that we just checked a few minutes ago. So I'm just going to lock that in place. And now I'm going to have you, first, both of them are open. I'm just going to block his left eye. I'm blocking. Now you're just viewing with this eye.
Right eye.
And compared to the left eye vision. How would you describe the right eye in comparison to the left eye?
My left eye is better than the right.
Okay.
Yes, I can barely read this, but with the left eye, I can read the letters clearly.
Got it. And so I'm going to remove this from in front of you. And so I'm going to show you guys what he's looking at. Let me try to do this. So he's looking at small letters far away over here. Okay. So that's what he's looking at. And so he's able to see a best corrected vision with his right eye is, that one's 20/30 and distorted. This is 20/20 and not distorted. Okay. One other thing to note is that everyone is different. Depending on how severe your retinal detachment was, depending on how long your retina was detached for, that will certainly impact the quality of your vision. But when you have cataract surgery, no matter what lens implant you get, even if you got the most advanced lens implant possible, if your macula was detached at the time of your retinal detachment, if your macula was separated, I would expect to see some distortion in your vision. Even if you're 20/20 or 20/30, you'll still notice a little imperfection in the way lines appear in that eye. So thank you so much for your feedback. I hope you guys found that information helpful. Catch you next time.
Thank you, Dr. Crab.
My pleasure.